Duodenal type follicular lymphoma. So this type of follicular lymphoma, this variant, is most commonly found in the second part of the duodenum, which is the small intestine, can also be found in other part of the small intestine other than duodenum. Um, in terms of the gross appearance, it's frequently found as multiple small polyps or nodule in the intestinal lining, and histological grading typically seen as grade 1 and 2 out of 3. Microscopic feature show follicle appearance and that resemble typical follicular lymphoma with irregular follicular shapes and size that's histologically indistinguishable. Immunohistochemistry will show all the B cell marker, germinal center marker, and BCL2. And genetically, if we look at it, fish will show translocation 1418, uh, the same as in follicular lymphoma. And here we can see the clinical features. Patients are usually asymptomatic. Majority of the patient will have localized disease in either duodenum or other part of the small bowel, and it has a indolent, known to be indolent clinical course, and regional lymphadenopathy is rare. Here we can see the histopathological finding of the duodenal type follicular lymphoma. If you see these villi, they are extended and with infiltrate, lymphocytic infiltrate, and they kind of reminiscent of the glove balloon sign. Like when you put the glove in the like a balloon, it's kind of like a sign, and this is very classic in duodenal type follicular lymphoma. And follicles are predominantly composed of small lymphoid cell, like in classic follicular lymphoma. And duodenal type follicular lymphoma, they usually tend to involve lamina propria of the mucosa. So you can see here, lamina propria is showing the infiltrated by the monotonous population of small lymphoid cell. And here in the high power, we can see these lamina propria is being infiltrated by these follicle. And they are CD20 positive as a B cell origin, and they are CD10 positive as a germinal center origin, and they are BCL2 positive, like in classic follicular lymphoma. So they have the same marker, and just to reiterate, that CD20 positive, CD10 positive, BCL2 positive, and Ki is typically low, about approximately 5 to 10% typically. And diagnostic molecular pathology will usually show translocation 1418 with IgH and BCL2 translocation. And just to differentiate between duodenal type follicular lymphoma and classic follicular lymphoma with intestinal involvement. So our entity is indolent as opposed to classic follicular lymphoma. It may or may not be indolent. And this entity show predominantly grade 1 and 2. Classic follicular lymphoma will show a variable grade, it can be grade 3 as well, grade 3A, grade 3B. It can be transformed to DLBCL after grade 3. But duodenal type follicular lymphoma stay in this grade 1 and 2. And they're very indolent, 100% um, survival rate, and sometimes they would just do wait and watch. Uh, Duodenal type follicular lymphoma is confined to lamina propria. Classic follicular lymphoma intestinal involvement can extensively involve beyond lamina propria and involve into the muscularis propria. In terms of the immunohistochemistry marker, they're basically the same. CD10, BCL6, BCL2, CD21, 23, CD35, and low Ki. And this is a brief tutorial on follicular lymphoma of the duodenal type. And thank you so much for watching.